everyone. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler. Today, I have with me a very special guest, Dr. Ken Anderson. He is a triple board certified facial plastic surgeon and a globally recognized authority in hair restoration. As the founder of the Anderson Center for Hair in Atlanta and Alpharetta, Georgia, he has dedicated over 2 decades exclusively to treating hair loss, pioneering techniques like the follicular unit excision, and introducing the ARTAS or ARTAS robotic system to Georgia. Dr. Anderson has earned numerous accolades, including the Best Hair Restoration Award at the 2024 Aesthetic and Anti-Aging Medicine World Congress in Monaco, and has been consistently ranked among the top 25 hair transplant surgeons worldwide since 2019. His practice is renowned for its innovative regenerative treatments such as exosome therapy and platelet-rich fibrin injections. Welcome, Dr. Anderson.
Well, thank you very much for that introduction. It's wonderful to be here, and I really appreciate the invitation.
Thank you. I do zero hair restoration other than some PRF, PRP injections here and there, and prescribing supplements. So you are the leader, you are the authority, and I know my audience is going to be really interested in what you have to say today.
Well, that's good. I think hair loss is it's in the news a lot. People are always concerned about hair loss. Like I sometimes, remind my patients, hair loss hurts. It's not fun to deal with. It can be frustrating to know what to do. So I've, as you mentioned, I've dedicated my career and my entire centers, to the treatment of hair loss, both from a non-surgical and a surgical standpoint. And I really feel we provide patients a lot of comfort, happiness, and solutions to their hair loss. But it's a lot of fun. I find it very rewarding.
That's amazing. So let's start with the basics. Who's a hair transplant candidate? Like, what factors determine whether a patient or a person is a good candidate for hair transplant surgery? And how do you assess this during a consultation or a meeting?
That's a great question. So, essentially, I personally see all the patients, and there's a lot of things to review in looking at whether a patient is a hair transplant candidate. I want to point out that typically, or at least sometimes, we don't step right to a hair transplant, right? And it's kind of sometimes should be a last resort after non-surgical methods are used. And so during a consultation, I go over with patients what hair loss is, what they can be doing about it to try to prevent future hair loss, and then how we can correct past hair loss through non-surgical or surgical means. An interesting analogy that I think is very helpful for patients to understand is that hair loss is a lot like dental decay, right? The reason we all brush and floss and go for cleanings. People get that. They've had that since childhood. Hair loss is also, a progressive phenomenon with currently no known cure that requires daily and periodical activities to try to prevent the progression thereof. So that helps patients out because sometimes patients say, well, how long do I have to use that topical medication? And I'm like, well, until we cure hair loss, really, if you want to keep your hair. So, in terms of determining candidacy, to get back to your question, really we look at a number of factors. Age is an important factor. I do have teenage boys in my practice, and I'm not going to offer an operation to someone so young. And so basically you got to be at least 24 years of age if you're a man, and have at least 1 year of effective prevention under your belt. And we want to see that hair loss is stable in order to consider that person a candidate. Female pattern hair loss is different. It tends to peak in incidence around the age of 50. So I don't have many young women in the practice. Another thing we look at is the type of hair loss. Now, the overwhelming majority of patients have male pattern or female pattern hair loss, which is hormone mediated. But there are other types of hair loss that I would want to look for because they are not amenable to hair transplant surgery. This includes all of the scarring alopecias and alopecia areata.
I was going to ask you the different types of hair loss because I'm sure my viewers assume it's kind of one type or one size fits all. Oh, you've got hair loss. You need to go get X, Y, and Z supplements, and then you may need a hair transplant. I feel like that's the general consensus or knowledge at the public level. What are your thoughts about the different types and what should people really be doing or thinking about doing?
Well, I would suggest, all right, so with the treatment of hair loss, I would say the most important thing is once you notice hair loss, maybe you're looking in the mirror or the rear view mirror or at yourself in a reflection and you see a little something missing along the frontal hairline, or maybe you see a picture of yourself and it looks like you might be starting to lose hair. Really, you're not alone. You don't have to deal with this yourself. I would seek out a hair loss specialist, someone who's sort of dedicated their career and center to hair loss, and go get an evaluation. And at that evaluation, the doctor will review with you your medical history and your medications and carefully examine your scalp to look for the signs of, perhaps some atypical form of hair loss. The overwhelming majority of patients are going to have just hormone-mediated hair loss, male pattern hair loss, female pattern hair loss. But there are cases under the umbrella. There are a number of disorders, like 10 or 12 of them under the umbrella of scarring alopecias. And these are not amenable to a hair transplant, need to be treated differently, oftentimes with steroid injections, low-level laser therapy, these sort of things. And a biopsy often helps to determine whether or not scarring alopecia is present. So I think an evaluation by a qualified practitioner is a good first step. It'll provide yourself some peace of mind and give you an action plan to moving forward.
Wonderful. So hair loss, is it genetic? Like if my mom loses her hair, am I likely to have that problem? Or if you're a guy, if your dad goes bald really young, are you at risk for that?
That's a great question. The short answer is yes. Hair loss, in fact, the medical term for male pattern hair loss is androgenetic alopecia. So the word genetics right in there. So yes, it is in our genes. Same with female pattern hair loss. And so that's the simple answer. The old wives, you hear, it comes from your mom's side. That is not true. It's not true. It comes from both sides. And so with men, I tell men I would look at your dad and your mom's brothers or your mom's father, because men on both sides can contribute to it. And so if your dad and mom's brothers have a lot of hair loss, it's quite likely that hair loss is coming for you. However, I will point out it's not strictly, simple Mendelian genetics. I've got patients in my practice who have hair loss. A 35-year-old gentleman will be telling me, he's like, I can't believe all my brothers have full heads of hair. My dad has a full head of hair. Nobody in my family has hair loss, but he has a lot of hair loss. So the genetics are not completely understood, but in general, you can kind of tell where you're headed by looking at your family history.
So if you are someone who has a family history, this kind of goes into one of the questions I have for you. Like, what can you do to prevent it? Like, should you start young? Should you take supplements? Like, aside from like, once you really notice it, seeing a provider, is there anything that people can do at home?
Well, I think that a number of factors in terms of lifestyle can contribute to hair loss. Certainly nutrition is near the top of that list. You want to have a diet that is high in protein and you're getting enough micronutrients like iron, selenium, zinc, vitamin D, and the B vitamins. Those all help. I think that stress plays an important part in hair loss. And, we all deal with stress, but I think that, exercise and getting a good night's sleep and meditating or practicing mindfulness are different ways to deal with stress. Alcohol intake can affect hair loss. Alcohol is a diuretic, and so we lose a lot of the water-soluble micronutrients like B vitamins and zinc. It can also reduce the absorption of these important nutrients in through the intestinal lining. And, if you drink a lot, some people who drink a lot don't have a great nutritional intake to begin with. So those are some things that at home, before you see a specialist, that you can be thinking about.
Sure, sure. So, I mean, we all hear like, oh, biotin. You just need to start biotin. Like, is that, I mean, that's one of the B vitamins, but like,
Yep.
Does biotin even work? Are people wasting their money?
You know what? That is a great question. So let's talk about biotin.
Okay.
Biotin is a B vitamin, because a lot of my patients I think there's a lot of mass confusion out there, and it's because of the marketing that's being done by these companies. Biotin is necessary for hair and nail growth. It will help your body to produce stronger hair and stronger nails, but it does not prevent the progression of hair loss. And that's stronger does not mean less susceptible to hair loss. So, right. I started taking it a few years ago. My nails got a little thicker. My hair I didn't really notice as much a difference in my hair, but, I knew deep down that it does not stop the progression. So despite what all the commercials say, that it helps with healthy hair, that's great. The hair loss has really very little to do with healthy hair. People with great diets, perfectly healthy hair, taking all the biotin, can still have a tremendous amount of hair loss. It's a phenomenon in and of itself, and needs to be addressed with specific therapy, of which biotin is not one of the therapies.
Good. That's really good information. So if you're worried about hair loss, you can throw away the biotin. No, I'm just kidding. You probably should still take it. Why not, right?
Oh yeah, I think that nutritional supplementation is a good thing. Unless you're super on top of your diet and measuring all the vegetables and that sort of thing. I think that a multivitamin can help. I do recommend in the practice Nutrafol vitamins. They do have science behind them. There's been a study that, there was that study with that showed about a 10% hair increase in hair density over 6 months. And the Nutrafol is different than a regular vitamin because it's not just general nutritional support, but it kind of gets to the underlying biological deficiencies that kind of underlie the progression of hair loss, including inflammatory mediators and DHT, but without being an actual drug or medication. But, in terms of nutritional support, multivitamins are good. Nutrafol is good. And then, like I mentioned before, a diet that is at least adequate, if not high in protein.
Okay, great. What about collagen supplements? So like these powders and, liquid collagens that are all over the market today that are marketed for healthy skin, hair, and nails. Do they have any impact on hair loss, or do they actually even work?
I think that the collagen supplements, if taken regularly over months, can improve some of the thickness of the skin a bit, which can improve fine lines and wrinkles. But I think it's going to be to a fairly minor degree. It's not really, it doesn't have any real effect on the progression of hair loss per se, though. That's not part of the recommended treatment. But I know they're very popular. I see them even at Costco.
Yeah, right. Exactly. Okay. So I kind of want to talk more about, hair transplantation, exactly like the procedure. Like you do robotic hair restoration. Like some of the listeners may imagine, going into a room and a robot, doing their hair transplant surgery. Can you tell us about this, in simple terms, and then kind of get a little bit more medical with us?
Sure. Well, let's just back up and just talk about what a hair transplant is.
Yes, please. Yes.
So a hair transplant, it's important to understand, it doesn't create any new hair. Really,
Right.
we're moving hair or transplanting it from one area of the scalp to another. If you think about, a middle-aged man with just a little rim of hair around the back and sides of his scalp, that is known as permanent hair and is
Okay.
not susceptible to the hormones that cause typical male pattern hair loss. Same with females. Females typically will lose hair on the top of their scalp, but still have some strong hair on the back and sides of the scalp. These hairs are just not affected by the natural progression of hair loss. So these hairs can be surgically removed from their location on the back and sides of the scalp and then implanted into the areas of need. Now, the secret is the hairs don't know they've been moved. And so they are sitting in their new location, perhaps in the frontal hairline, and they're just going to continue to grow there as if they're sitting in the permanent zone on the back and sides of the scalp. So that's sort of generally how it works. In terms of moving the hair there are two main methods. One that's kind of losing favor these days is called the FUT, or follicular unit transplant, which is where it's basically the two differences in the two different types of hair transplant are just based on how we harvest the hair from the donor area. In essence, the FUT, or the strip method, is where we'll take advantage of the fact that, the scalp has some looseness. You can press on your scalp and rub up and down. So the surgeon takes advantage of that and takes a thin little strip of scalp on the back and sides of the head. That scalp containing all the permanent hairs is then passed off to the technicians, and they'll divide up all the hair follicles under microscopes. This little wound is sewed up, and then the hairs are then prepared for transplantation into the area of need. And we'll get to that part in a bit. But the other method is called FUE, follicular unit excision. It's very popular these days. And this is a different way of harvesting the follicles from the donor area. And it involves using essentially a circular rotating punch to core out one follicle at a time from the donor area. The advantage to this method is that it doesn't involve a scalpel. There's no removal of a strip. There's no stitches used. And there's no linear scarring on the scalp at the end of the day. And then forevermore, those patients will not have a linear scar on their scalp, allowing for much shorter hairstyles in the future.
So when you remove them in the FUE method, or the follicular unit excision method, is that area where you're taking the hair from, does that now become more thinned?
That's a great question. Technically, it does.
Okay.
But hair has a visual redundancy of about 50% or 2x.
Okay.
In that you can, in almost everyone, you can take out every other follicle and it will still look the same cosmetically.
Gotcha.
Now, that's not to say in an FUE procedure. I mean, in a transplant, typically 1 out of every 7 or 8 follicles is removed. And so with that slight decrease in density, it looks exactly the same. But technically, if you got the microscopes and tiny rulers out, the density does go down a smidge. But cosmetically, it's really not noticeable.
So you're doing more of the FUE method, I assume.
Yeah, these days I would say it's about 80% FUE, 20% FUT.
What makes you, or is it a patient factor, which method you choose?
Well, it's elective surgery, so I will often listen to the patients and if they want one or the other. Medically, if a patient has, say you've got a gentleman with fairly advanced hair loss and has just got that rim around the back and sides, well, if you think about it, with the FUT, we're taking a strip of scalp out, and then 100% of the follicles on that strip are going to be used in the transplant. Whereas with FUE, to get a large number of follicles, you need a generous amount of surface area of unaffected hair on the back and sides of the scalp, because you're only taking out 1 out of every 7 or 8 follicles. So if the rim isn't that large, then you're going to get a lot. And we need, obviously, because there's a lot of hair loss, we're going to need all the follicles. An FUT in that scenario might make a lot more sense. So that's one case. Occasionally we trim down the hair on the back and sides to do an FUE, and sometimes guys don't want that. And
Yes.
really, I
Okay. I
think
was wondering about that because you see guys, who just had their hair transplant and, things are shaved and things look a little crusty. Like, can you tell us about that process? Like, how long's the procedure? What do you look like after? How long do you need to keep covered if you have to be covered?
well, very good. I just want to make one more comment about the FUT because the FUT method doesn't involve any trimming down of any hair. It leaves a scar sort of on the back of the head, right where a female ponytail would go.
Yeah.
Most females end up opting for the FUT because it's just
Sure. Get more follicles
it doesn't take
potentially.
as long. You get more
Yeah.
follicles. Okay, you're going to have a little fine line linear scar on the scalp, but the females are always going to have long hair, so you'll never see it. So typically females will go for that. In terms of
Gotcha.
if we talk about the FUE procedure, which is the most popular, typically we'll trim down a little bit of scalp on the back, a little bit of hair on the back and sides of the scalp. We leave the top long. I joke with patients. I said, you're going to look like a European soccer star with the
Yes.
high top fade. And the hair is trimmed down to allow us to use the instruments, including the robot, to accurately assess the angle of the hair as it exits the scalp. The procedure is done under local anesthesia. Okay, so there's no
Okay.
IVs inserted. There's no breathing tubes. I just use a tiny needle to numb the scalp up. I do use sedation. Most
Okay.
places do. So I use a combination of oral Xanax and a little bit of intramuscular Versed for
Okay.
the medical folks out there. For everyone else, basically you're going to be kind of snoozing, sleeping through most of the day. Like yesterday's patient, he kind of woke up at the end. I said, we're finishing up, my friend. How you feeling? He's like, I feel great. He's like, a better question is, what time is it? I said, it's
Yeah.
3:00. He's like, oh my goodness. The day just flies by for patients. And that hits on my next point, the length of the procedure. They're long procedures. I mean,
Yeah.
it's not a quick
I've always
fix.
heard that. Yeah.
Yeah.
It's like a day event, but
Yep.
it's worth it.
Yeah, patients will need a ride home after the procedure because of the sedation, but typically, on a medium case, it takes, 5 hours from arrival to departure. On a big case, it can take 8 and sometimes up to 10 hours. It sounds like a long time, but, at our center, at least, we have very comfortable chairs. The patients will be watching drone videos on the big screen TV, and we listen to cool music. But by and large, the patients will sleep through the day, and the time passes super quick for them.
Sure. Now tell me about this robot. What does the robot do for the procedure?
Okay, the robot is it's just really a tool. Okay, it's a tool that the doctor uses and moves around to accomplish the extraction portion of the FUE procedure. In terms of why patients are coming to see me, they're not coming to see me for fancy removal of hair. They want hair where they need it, in the frontal hairline, in the crown, at the edges. That part is all done by hand. And
Okay.
to me, that's like a little work of art. I took an art degree in college, and really every day I'm privileged to be able to create works of art. Creating those recipient sites to me is like creating a stipple art drawing. So it's a lot of fun, and I love it. But in terms of what the robot does specifically, it's a little device, sits on a cart. It has a 6-jointed robotic arm. And at
Uh-huh.
the end of that arm is a little box, and the box on it like a robotic head. The head has 2 stereoscopic cameras or eyes, and in the middle is a little retractable punch. Then I will sit, the doctor sits at the workstation as looking at a monitor, and he's kind of seeing what the robot's seeing out of those 2 cameras. And the robot will kind of fixate in right above the scalp in the donor area and have a look at these little, the trimmed down hairs. And then at the surgeon's direction, it will punch out individual follicles. Again, this sounds painful, but I promise it's 100% painless to patients. It'll feel like, someone's just kind of touching the scalp, but there's
Yeah, because I
zero
can
pain.
imagine it's microscopic. It's like very fine little removals.
Yeah, the punch is 1 millimeter in diameter.
Right.
So it's a really tiny punch, but the robot is one way to do it. And yes, I introduced the robot, the artist robot from Venus Concepts. I think we had the 23rd robot on the planet back in 2012. And I used it to do all the FUE procedures from about 2012 through about 2021 or so. You know, this is a big world, and and because of the increased popularity of FUE surgery, so many different manufacturers have come out with different designs for the tool to perform FUE. And so we've kind of moved on to a different tool called the WA Duo FUE system. WA WAW. It's from Devois Instruments in Belgium, and the ingenious thing there is their punch design. It's brilliant. It cuts down even further on the transection and creates even smaller donor wounds, and it's a little more comfortable for the patient. The robot is still available if patients really desire that, but I think that a lot of surgeons have moved on from the robot. I'm not sure it's as popular as it once was, but it sure is fancy technology.
Yeah, sure. So between hair transplant and vitamins and topicals, I know you do a lot of non-surgical treatments and use regenerative medicine. So
Yes.
tell me about those options and like who's a candidate for those, and just give us a little more information.
Very good. Well, I think there's been, as in many areas of medicine, there's been huge breakthroughs in regenerative medicine. PRP has been around for almost 20 years. And now more recently, we're using PRF. In essence, what regenerative medicine is harnessing growth factors and cytokines and sort of molecular stimulants to encourage hair that is thinning to stop thinning, and in some cases, reverse the process and grow thicker, stronger hairs. And so we've had a lot of success here over the years using PRP, PRF, and exosomes to reverse hair loss non-surgically. In terms of who's a candidate, it works best for patients who have thinning hair, but not hair that's completely absent. Right? If you if you have someone who has lost their hair and it's just shiny skin, those follicles are permanently dormant and are not coming back. But if you've got someone, who's having a lot of see-through hair, you can kind of see through the top of their scalp, maybe even see the outline of their scalp, but the hairs are there, but they're much more fine. Those are more often candidates. And this describes a lot of female patients who have hair loss on the top of their scalp where it's starting to get thin. The hair is there, but you can kind of see through it. I think
Mm-hmm.
that that's where regenerative medicine treatments like PRP and exosomes really come into play.
When you do those treatments, is it typically like a series, like you want to do several in a row and then maintain, or I'm sure it's patient dependent, but what's your, basic starting protocol for this type of thing?
Well, let's talk about exosomes first. Exosomes are also a regenerative medicine treatment, and it's a biotechnology product. And exosomes are the products of stem cells. Essentially, it's how stem cells communicate with tissues. They secrete little exosomes that are full of cell signaling agents and growth proteins. Those, I think, are the most powerful. That's the most powerful regenerative medicine treatment that we offer. The appointment itself is about an hour long, and a little local anesthesia is used. We don't do any sedation because it's so short. I just need to inject carefully all the exosomes, and we do some microneedling with peptides as well. And so those patients, I think, do quite well. The PRP is a bit different. It uses the patient's actual own individual blood, and from which we spin it down a couple of times in the centrifuge and concentrate the platelets. And the platelets are the cells in the body that contain the growth factors and the cytokines and stimulants that are then injected in the same manner as the exosomes into the areas of thinning hair.
And then do you recommend repeating that like every so often?
Yeah. Good question. So with the exosomes, typically it's a one-time treatment. We can sometimes repeat that 6 months later if we get a large but not complete response. There is going to be
Okay.
a small percentage of patients who are not going to respond. And so with those patients, we would not repeat it, but the vast majority of patients do respond. With PRP, it's a little bit different. There really, in the medical field, there is no set prescribed dosing
Mhm.
schedule. The
Right.
PRP itself, every procedure should be identical. We produce the same amount. We draw 60 cc's of blood. We produce 6 cc's of platelet-rich plasma or platelet-rich fibrin, depending on what we're doing. And it should have the same high concentration of platelets. The difference comes in the schedule of the treatments. If we're looking more at trying to regrow hair, what I recommend is 6 treatments about once every 4 to 6 weeks.
Okay.
Then we kind of wait about 3 months to see the response. And then we go into more of a maintenance dosing. And that would be once every 3 to 4 months for the PRP. And that's part of
Okay.
the, general prevention package that I suggest pretty much all patients do that have androgenetic or male pattern hair loss and female pattern hair loss is the maintenance dose of PRP at a minimum. But a good question there to get it to grow, you want to do it a little more often.
Sure, sure. And what about, should people be using like Rogaine, minoxidil? Should they be painting that in their hair using the foam? And what they see on TikTok right now is that you have to use it and you have to keep using it for life to see the results and for the results to last. Is this true?
Well, I hear that a lot from patients. I don't want to start using minoxidil because if I stop, I'll lose the hair. And I typically at this point in the consultation, I've mentioned the dental analogy. I'm like, well, yeah.
Yeah,
What happens if you stop brushing your teeth? Right? No one's going to
exactly.
refuse to brush their teeth because if they stop, they'll lose their teeth.
Right.
Similar concept. So yes, the medication minoxidil is very effective, especially in combination with finasteride for men to prevent future loss. In some men, it will actually regrow some hair, but they are long-term medications, and patients need to understand that. And I think that down the road, I think, 10, 12, 15 years, there's going to be, as continued breakthroughs in regenerative medicine happen, I think we're going to arrive at something that may not be a literal cure for the hair loss process, but something that is more or less amounts to a cure, that some treatment that's yet to be invented that will work for 98% of patients to effectively stop hair loss. So until that day, yeah, I think
Hmm.
that um, topical. I do prefer topical medications to oral medications. I know
Okay.
there's a lot of talk in at least in our world about oral minoxidil. Of course, a lot of men take Propecia. I think there's a safer way to get exposure to those medications, though, especially in the long term, and that is
Yeah.
through topical medication. The one that I recommend to patients is from a company called Xion, Xyon. And they have
Okay.
a nanoparticle gel, and that gel helps to slow the transition of the medications through the skin and into the bloodstream. So the nice thing is it keeps the medications in the scalp longer and lowers the amount of the medications that get into the bloodstream. So I think it minimizes the amount of possible side effects, especially in the long term.
Wonderful. What are some of the side effects, just for people who have been told you need to start Rogaine? They buy it, over the counter, which you can get it these days. Like, what are things that they need to look out for if they start doing this?
Very good. The number one complication of using the topical medication is local skin irritation. It can get
Okay.
a little bit red. It can maybe a little bit itchy. It happens in a minority of patients, but still, that's the number one complaint that patients will report. In terms of specific medication-specific side effects, with minoxidil, um, it can cause paradoxical hair growth in other areas of the body. And
Okay.
this is, typically not a problem for men. They get a little more hair on their back. All right. But for women, this could be a big problem, right? So some women,
Yeah.
yeah, yep.
We go
So
to laser hair removal for a reason.
that's a very good point. But a minority of women will get a little bit more hair growth, perhaps on their forehead, on their
Mm,
cheeks, even their arms. And
mm.
this can happen even with the topical medication. This tends to be self-limited, but it does last for a number of months before it goes away. Other than that, I think with minoxidil, especially if you're taking it orally, it's not so much with the topical medication, but orally you can get heart palpitations and feel a little bit lightheaded because it is a medication that lowers blood pressure. And
Gotcha.
then in terms of the finasteride, that's really just for the men. Because it really addresses the core cause of hair loss for men. The main side effect that people worry about and that occurs is a decrease in sexual libido. And
Mm.
this can happen in the studies show in about 2 to 5% of men. But anecdotally, when I talk to my colleagues, it can be slightly higher than that. It can also cause a decreased amount of the ejaculate. It can cause increased consistency of it. And in a very small percentage of men, it can cause decreased sperm motility. The good news is these could be almost virtually avoided by using the topical version of these medications. I have been prescribing the topical medication for several years now, and don't have any patients complaining of any of those issues from a finasteride standpoint.
Amazing. So obviously, I do a lot of surgery, mommy makeovers, things like that. And in the world that we live in today, we see a lot of people who have had maybe weight loss surgery or are on Ozempic and have lost 100 pounds. And you see a lot of hair loss with these people, either from the weight loss or from the trauma of having a surgical procedure. Like, what would you recommend to those people? Should they try to take something preventative before, if they know that they're going to have a procedure or undergo massive weight loss? And or what would you recommend that they do afterwards?
Well, I think that in terms of, let's talk about Ozempic first. I
Sure.
think, Ozempic just causes, among other things, a decreased appetite.
Yeah.
I think that just the actual lack of getting enough protein and nutrients into the body can be a real concern. So with patients taking Ozempic and expecting and hoping for a large amount of weight loss, I would, carefully monitor the protein intake. Make sure you're
Yeah.
getting enough protein, and also take a multivitamin to make sure you're getting enough nutrients, and consider taking something like Nutrafol to address hair loss specific needs. In terms of undergoing general anesthesia, I'm not sure there's much you can do to prevent that. But I think certainly afterwards, just what I just mentioned about nutrition, I think low level laser therapy is an
Okay.
excellent way to, without any medication, to stimulate the hair follicles to get going again. And you could also consider using finasteride and or minoxidil and frankly, regenerative medicine treatments to
Sure.
stimulate the hair follicles to start to regenerate big, robust hair shafts, and get your hair back quicker than
Then just natural time.
right, than just naturally coming back.
Exactly. Okay. I did find out that you're doing something, or you're considering starting follicle banking. Can you tell me a little bit about that?
Yes, that is exciting. So, all right. So as we age, right, we're all getting older. The cells are getting older, and the quality of the DNA in these cells continues to decline with age. Getting old is fun, right? And so,
Yeah, right.
kind of, right. So it's sort of along the same lines as, when they're doing umbilical cord stem cell banking for little babies.
Yeah. Yeah.
This isn't, we can't turn back time and do that for adult patients with hair loss, but really we're never going to be any younger than we are today. And so for patients who want to bank their stem cells for the day when cloning becomes a reality, this is a way that, to do that. And essentially a tiny, tiny little bit of scalp hair is taken and is snapped, frozen at minus 80 degrees Celsius, and then transported on dry ice over to Europe, where they're stored in a freezer complex. And it's really just cataloged there, and it remains there. There's so much research being done on how to clone hair. That's kind of the holy grail of hair loss. And so when that becomes clinically available, suppose it's 20, 25, 30 years from now, well, your stem cells are going to be that much older. And so this is an opportunity for patients. And I think it applies obviously to younger patients to be able to save some of their youthful stem cells for the possibility of later in life when they really need all the hair back, for them to have those stem cells available to create, robust young 25-year-old hair.
That's great. It's kind of like freezing your eggs for women.
Right? Yeah. Very similar. Very similar. Pretty high tech. And
wonderful. That's so cool. I mean, just curious, like, do you have people who are doing this? Like, do you have patients who have frozen their follicles yet?
It's not the most popular service, but yes, there are some patients that come in asking about that for certain. It's a busy practice. We see a lot.
How much does that cost? Like, are you paying like a monthly subscription to keep like freezing your eggs? You pay a monthly fee?
No, it's a one-time fee.
Okay.
Yeah, I think it's what, $3,500 or something like that.
Okay. If you're someone who's expecting that you're going to have this genetic, hair loss down the road, it's probably worth that $3,500 or whatever it may be.
Yeah. Well, I think, it's less than a transplant, most transplants, and it could potentially provide, an infinite amount of hair later in life. I think it's an exciting area.
Okay. Well, I feel like this has been very interesting so far. I have, really one more main question that I want to get to. Like, what do you feel like is the future of hair restoration? Like, is it going to be more regenerative medicine, cloning, stem cells, or robotics? Like, where do you think it's going to hone in on, or do you have any predictions?
Well, I think that cloning is the holy grail. I don't think that's the next breakthrough.
Okay.
I don't know if robotics is going to be the next breakthrough. I do think it's going to be something in the arena of regenerative medicine. We've seen great strides with PRP and exosomes. I think there's going to be something coming. I mean, I read about a medication, a topical medication called ET-02 or ET-02 from Irion Therapeutics. And they showed in just 6 weeks, they showed a 5-fold increase in terminal hairs. And so they've completed a phase 1 clinical trial. And so they're getting ready for their phase 2 clinical trial. And for the folks out there, it's several years away from being clinically available. But I think we're tinkering with the molecular genetics of what turns hair follicles off. And I think that's going to be, we're going to find the solution to that in little steps. Until then, we're left with what we have today, which I think, it's never really been a better time to have hair loss. When I started in the field in 2003, we didn't even have the FUE procedure. We had linear strip procedures. We had finasteride, we had minoxidil, and we had a handshake. We didn't have the laser therapies. We didn't have the regenerative medicine treatments. But I do think it's come a long way. And, getting just another comment about the basics of hair transplant that I neglected to mention, patients sometimes ask me, well, can I color the hair? Do I have to cut it? And I want to emphasize that when the transplant is completed, as I mentioned, that hair is now going to be growing in the new location as if it's still in the permanent zone. So it's permanent hair. It's naturally growing. You can cut it. You can curl it. You can color it. You can style it. You can do whatever you like. The differences among hair transplant surgeons, largely based on experience, but also really the artistic aptitude of because it really is an artistic endeavor. And to me, the hair should look like it's always been there, not like somebody put it back. So it can't look, I see a lot of unfortunate hair transplant results on social media with these very low, very straight hairlines, which I promise you will will not age well. So at least for,
Right.
for guys coming in, even if they're 30 years old, I tell them this hairline has to be absolutely timeless. It's got to look good when you're 30 and when you're 90. And so
Yeah.
it's there's so much artistic input into it. And I love that about it. But really, just again, to the folks, it's your own growing natural hair that should look like it's always been there and not like a fake or artificial look.
Sure. Well, and I think what's super important is that if you're looking into having a procedure like this or just getting counseling for hair loss, you want to go to someone who's excited about it, like you are.
Well, I would hope so. I mean, it's a lot of fun. I have the greatest patience. I mean, the gift of being able to give someone back their hair. I promise you, it's like giving someone back a piece of their youth.
Yeah.
They're just so excited about it. I had this. Do we have time to meet? Can I tell you about a patient I had?
Yeah, please.
I had this patient. All right. So the year was 2004, and I had just been doing it for about a year. And it was a big thing. My training is in ear, nose, and throat surgery. And I'm also board certified in facial plastic and reconstructive surgery. And to just jump both feet in and really dedicate my career to hair restoration surgery, I'd raised a bunch of eyebrows because it was very, very uncommon at that time.
Sure.
But I saw I knew it was going to be big, and I loved the surgery, and I was just getting into it. So I had this patient come to see me. He was 77 years old. Let's call him Frank. That's obviously not his real name, but Frank was 77. He had a lot of hair loss. His remaining hair was white, like my white coat. And he was very, very stoic. And he said, after we talked about the nuts and bolts, he took out of his blazer pocket. This is in Beverly Hills. The first 10 years of my practice, I was in Beverly Hills. He took out of his pocket a picture of young Elvis.
Wow.
And he pushed it across the table. And I said, all right, Frank. And so I didn't really do anything special with his hairline. I just gave him a great hair transplant and put it where it should be. But he came back, and here's the best part. He came back a year later, and he said he's not very tall, but he came in with a white pompadour, just like young Elvis.
Uh-huh.
And I said, Frank, how you doing? He said, after we sat down in the consult room, he said, Dr. Anderson, I want to tell you. He said, this is the best thing that has ever happened to me. I said, there's no way. I said, Frank, you've got great grandchildren. That's magnanimous. It can't. And I tried to talk him out of that opinion, but he said, no, I'm not kidding. I am not kidding. This is the best thing that has ever happened to me. And I knew, I thought, wow, I didn't really see that kind of joy in my facial plastic surgery patients.
Sure.
And so there's something special about hair patients. I love it. And, it's like getting to come to work and create little works of art every day and deal with a lot of happy patients. So it's a lot of fun.
That is so nice. I love that story. Where can people find you, Dr. Anderson? Like, where is the best place for them to reach out? Obviously, we know you're in Georgia, but how can they connect with you? Maybe get a consultation? Give us the information.
Sure. We offer in-person and virtual consultations. We've seen patients from, I think, 53 different countries right now, and every state except North Dakota. So if you're in North Dakota, come on.
What the heck, North Dakota?
The website is atlantahairsurgeon.com, atlantahairsurgeon.com. And the phone number is area code 404-256-4247. You can find me on Instagram. My handle is Ken Anderson MD, all one little phrase, or just Google Ken Anderson hair transplant. It'll pop right up. But those are the different ways you can come find us, and we'd be happy to see you.
That is wonderful. I'm sure you're probably going to get many interested people. This is, like you said, it's a sensitive topic because when you suffer from hair loss, it's very personal and it affects your confidence.
Yes.
And if you can find someone like yourself who's excited about it, loves to do it, and has methods to help it get better, I feel like there's no other way.
Yeah. Well, I encourage patients, like I mentioned at the beginning of the podcast, as soon as you notice it, that's when you want to link up with a qualified hair transplant surgeon. You can give me a call. It's really more of an educational meeting. I tell patients what they need to know so they can take that information and make their own choices. But I think given there's more than 100,000 products in this country marketed for hair loss, but there's a small handful that actually work, and we can talk about those and what might be right for you. But yeah, give me a call. The consultations are kind of fun and enjoyable and mainly informative.
Wonderful. Well, thank you so much for sharing your knowledge. This was incredible.
Well, you know what, Candace, thank you so much. I really enjoyed being here today. It was great to meet you at the recent meeting in Palm Springs. And Al is great. Dr. Carlotti, he's awesome. Please tell him I said hello. And
I will.
I will look forward to seeing you soon at the next meeting.
Yeah, definitely. Next AACS meeting for sure, if not somewhere else. Thank you so much, Dr. Anderson.
You're welcome.
And everyone that's listening, make sure you follow Dr. Ken Anderson. Follow him on Instagram. I will tag his website. I will put his Instagram, and I will put more information in the show notes. So check out that. And make sure, if you haven't already subscribed to my podcast, please do, and leave a 5-star review. Thank you again, Dr. Anderson.
Pleasure to be here. Thank you so much, Candace.